Hello, everyone, and thank you for joining us today for today's webinar, Organizational Policies and Practices that Promote Safety Within Programs. And this is our third session on a series based on our guide, Committed to Safety for All Survivors, and how to really advocate for survivors who are using substances. And today's webinar is hosted by the National Center on Domestic Violence, Trauma, and Mental Health. My name is Gabriela Zapata-Alma, and I'm the Director of Policy and Practice on Domestic Violence and Substance Use with the National Center, and I'll be today's presenter. So before we get started, I'd like to go over some technical details of the WebEx software that we'll be using for today's webinar. Many of these details are explained on the Using This Webinar System tab in the center of your screen. You can switch to this screen from the slides by clicking the down arrow next to where it says Using This Webinar. Please be aware that your screen might look a little different depending on whether you're using a Mac or a PC or some other kind of equipment or technology. On the right-hand side of the screen, there are multiple boxes. Third from the bottom is the chat feature. You may have to click on the chat cloud icon at the bottom center of your screen to open up your chat. This feature will allow you to provide feedback and share resources with your fellow colleagues, as well as get in contact with myself or with Carla Alegria. Carla Alegria is here with the center, and she is providing all of our support for this session. So she is very happy to help if you have any trouble with troubleshooting the WebEx software. So in order to contact us or share with your colleagues, click the down-facing arrow and select the person you'd like to contact. There'll be a lot of options there. But for this session, you'll probably want to select all participants if you want to respond to a question that I pose or share something with your colleagues. You can also click on just Carla Alegria to privately contact her if you need any help with troubleshooting the WebEx software. So let's go ahead and test this chat feature. Well, everyone, please go to the chat box, click on all participants, or everyone it might say, and then type in where you're calling from and press enter. All right, Oregon, New York, DC, Michigan, excellent, Illinois, Arizona, California. This is great. Oh, this is so exciting. I love seeing where y'all are calling in from. Alaska, yes. Thank you so much, everyone. Ooh, in Canada as well, neat. Welcome, welcome. Perfect. Thank you all very much. So while the chat feature can be great for sharing resources and hearing from one another, there's some times where it moves really quickly and it can feel a little bit distracting. So if it's at any point distracting or just kind of a little bit too much for you, at any point, feel free to minimize the chat box by clicking the arrow next to where it says chat. You can always open it again with the same arrow if you'd like to. Ooh, I see Hawaii's here. Yay! Excellent. And then we'll be providing live captioning during this webinar. Below the chat box, there's also a place where it says Media Viewer Box, and this will contain the captions. Again, if you don't want to see the captions, you can click on the down-facing arrow next to the word Media Viewer, the same way you would if you wanted to close the chat box. We have planned time for Q&A, for question and answer, towards the end of this webinar. Feel free to be putting in any questions as we go, and feel free, there's also a Q&A section, feel free to put things in there as well. And at the very end of the webinar, you'll be taken to a brief survey. Please take a moment to let us know what was useful and what could have been better. If you get disconnected at any point, return to the email you received with the original webinar link and re-enter the training. And sometimes the sound cuts in and out because of the internet connection. So feel free to call back in if that's a problem. And if you're experiencing any technical difficulties and are unable to contact Carla Alegria, you may call the WebEx tech support to resolve any issues. That number, which Carla will also post in the chat, is 1-866-229-3239. And again, thank you for joining us today. So now we're just going to jump right in. So there's me, there's my information, and so I'd love to hear from y'all what kinds of programs you're calling in from, whether it's, potentially residential programming or coalitions or community-based advocacy, legal advocacy. That gives me an idea of some of the things that might come up. And a little bit about my background. Before coming to the National Center, I was working in formal treatment for substance use disorders and for mental health concerns in an intensive outpatient and outpatient. So before being the director of that treatment program, I worked in actually housing and resource advocacy and medical kind of care coordination for over a decade, working with folks impacted by chronic medical conditions as well as domestic and sexual violence. So that said, for folks who may be in more of a residential or kind of congregate living setting, I have definitely worked in those programs, and it can be a little bit different when we work where someone else lives. And so feel free to bring up any questions that, are really specific to your community, to your setting, as well as more general questions, of course. And then just a little bit of information about our center. We're a FIPSA-funded special issue resource center dedicated to addressing the intersection of domestic violence, trauma, substance use, and mental health. And so here are a lot of the different services and resources that we offer. And here is the information on the grant that supports today's webinar. And of course, our disclaimer that the views things that I represent today do not necessarily reflect the official positions or policies of the U.S. Department of Health and Human Services. And at the center, all the work we do is rooted within this integrated framework that everything we do is really within survivor-defined approaches. Survivors are the experts in their own lives. They know what may be helpful, what could be possible and realistic, what could be safe for them in this moment. That everything we do is really centers physical and emotional safety, understanding that this isn't something that we decide for somebody else, but this is actually, people define this for themselves, and that it's our role to find out how somebody defines their own safety, what helps them to feel safe, both physically and emotionally, and to really integrate that into the services that we offer. That everything we offer is based in relationship and connection, that the work and the healing is relational and is rooted in hope and resilience. And that this forms the core of then our advocacy, trauma-informed approaches, human rights and social justice-based approaches, and approaches that have both awareness of and responsiveness to cultural, historical, and community context. And so that's our framework, that's our lens for the work that we do at the center. And so everything in this session today can also be found in this guide that is available for free on our website, Committed to Safety for All Survivors, Guidance for Domestic Violence Programs on Supporting Survivors Who Use Substances. And today is, as I mentioned, the third session in a 5-part series based on the guide. And so in our webinar library, you can already access the first and second sessions. And then in March, we'll do the 4th session, and in May, we'll do the 5th session. I also want to point out that there is already a recorded webinar on overdose prevention. And so you can already access that in our webinar library. And the date of that webinar, in case that helps you find it more easily, is August 19th of 2019. And please let us know in our training evaluation what other topics related to substance use you'd like to see covered in a webinar. Now, if you don't already have it on hand, I recommend that everyone pull out their program policy manual as a way to really compare some of the things that we'll be talking about today, as a way to kind of highlight some of the ways that you're already cultivating an environment that supports safety through your policies and practices, as well as to note what are some policies that you may want to reconsider. And something I'll mention is that, you know, for folks who are receiving funding from FIPSA that talks about, you know, voluntary services, as well as many OVW regulations that also will talk about, you know, not screening people out of services because of substance use and things like that, that everything that we're going to talk about today is aligned with those regulations and will help you, will support you in really aligning with those regulations. So I really hope that today can be a resource for folks in that way. And now I'm going to put this link in the chat. And let's see. I'm going to just copy this link really quickly so that I can put it in the chat. And what it is a way to just anonymously share with us what are, you know, one or more situations that involve substance use and feel particularly challenging. And so by really getting this information from you, I can do my best to cater some of the information that and some of the examples I talk about in today's webinar, as well as in future tip sheets and webinars and other resources that speak directly to some of those challenging situations. Now, that said, a lot of times when we are you know, reflecting on our skill set, when we are looking to expand our toolkit, a lot of times our mind goes right to the most challenging situation, and we're like, well, how's it going to help me with this very, very challenging situation? That's really common. That's really natural. And at the same time, if we were to try to use kind of a new tool or a new skill set with the hardest situation possible, we're often setting ourselves up for failure at that point. A lot of times we actually, in any kind of learning we do, we tend to learn a lot better when we're able to think about those situations that aren't the most challenging, and what does it look like to apply some of that new learning or those new ideas in those kind of, you know, less challenging situations. But for the purposes of this question, I invite everyone to enter either in this, you know, using this link, or feel free to enter in the chat as well. What are some challenging situations that involve substance use? Thanks so much, everyone. And now I want to hear from you all. So what are our values and intentions when it comes to supporting survivors who use substances? What are our values and intentions? What do we want our services to be rooted in when we are supporting survivors who use substances? And go ahead and enter that in the chat. So I'm seeing evidence-based. Thank you, Brianna. Harm reduction, meeting the client where they are. Yes, Vanessa. Care should be holistic approach always. Thank you, Darius. Trauma-informed services that support overall well-being and minimize trade-offs in other areas of life. Thank you, Sunny. trauma-informed care. Yes, Hakeem. Yes, I'm seeing a lot of trauma-informed here. That they may receive treatment safely. Yeah, for a lot of survivors, those who are interested in treatment, there can be a lot of barriers to safely accessing treatment. And so part of our role is absolutely supporting that safe access. Ensuring that clients are getting the best services that are going to help them sustain their quality of life. Thank you, Jessica. Quality of life as a person defines it for themselves. Trauma-informed, understanding the root of substance use and disease. Thank you, Jamie. And Claribel, great to see you here. Avoiding stigma. Yes, stigma is so harmful. Safety is job one. Yes, many times a survivor uses because it's self-medicating against other things. Thank you, Shirley. Survivor-centered. Thank you, Martina. And culturally responsive. Yes, Deborah. And effective. Thank you, Camilla. So keep it coming. Keep putting your responses in here around your values and your intentions when it comes to supporting survivors who use substances. And I start here because, you know, it's easy to fall into the trap of trying to change somebody's behavior or trying to make ourselves feel like we have a greater sense of control through creating a whole lot of different rules, right? And that we're going to talk a little more about how that can actually get in the way of safety. And so when we're feeling like we don't know what to do, when we're feeling like, you know, that when we're feeling that temptation to go into the kind of top-down approaches or, well, we need to make another rule about this, when we're feeling that pull, what I invite everyone to do is come back into our values and our intentions to really stay rooted there. And that really our answers, if we can remain kind of grounded, our answers are best found here. So a lot of what folks have shared, really honoring each person's wholeness as a whole-souled being, as a holistic being, providing support that's culturally responsive, preserving dignity and choice, right? Preserving that respect. Using person-first language, of course, avoiding all that stigma and labeling, avoiding re-traumatization within our services, remaining present and non-judgmental. A lot of times it can be easy to get pulled into different assumptions or conclusions, but really remaining present, remaining connected and caring, facilitating access to our services and our support, so not turning folks away or not kind of limiting people's choices. And of course, the no wrong door approach. So now I want to hear from y'all, what's some of that flip side? What gets in the way of our intentions, right? Because all that sounds very nice, and yet those are, for many times, are very aspirational. Biases, yes. And these biases can be, I see a lot of biases and stigma coming up. And they can be explicit, meaning that we're aware of them, or they can be implicit, where they, you know, we all hold biases and they kind of sneak into our thoughts and our decisions and our behaviors, many times without us noticing it. A lack of mindfulness. It can be very easy to, right, kind of be off center here, not be in contact with ourselves in the present moment. Power struggles. Thank you, Lena. It's so important for us to be aware any time that we are kind of devolving into that power struggle. That's a big one. Social norms and how so many social norms reinforce that stigma. and that we're talking about multiple layers of stigma. Stigma having to do with being abused or experiencing interpersonal and sexual violence and domestic violence, stigma with using substances. There's actually added stigma for women who use substances, and even more stigma for anyone who is a parent or maybe pregnant and is using substances, on top of all the different kinds of discrimination and oppression that people face. Personal experience with substance use. Yeah, so lived experience can be our superpower, and sometimes it can also lead us to thinking that maybe what was true for us is true for everyone else, or that the way that, we were able to maybe find a path towards healing is something that that needs to be true for someone else. And so there can certainly, I would say, lived experience can be a superpower, and it can also sometimes be a place where our own experiences kind of get brought up, and then it becomes harder to remain connected and present to somebody else's unique experience. And there's a lot of different ways that shows up, right? Not just personal experience of substance use, but potentially the substance use of a loved one or of a previous partner or current partner, or just our personal experiences just within our community. Social and cultural differences, communication and language. Yes, absolutely. There can be a lot of difference that gets kind of misunderstood, mislabeled, and then judged, right? And how much our services requiring somebody to kind of be somebody, requiring someone to not be themselves in order to be able to access our service, or really, only offering services or only affirming people who approximate kind of a mainstream culture. One of the things that evidence has shown in, I will say, the substance use treatment world is that a lot of times people of color, when there are huge barriers to even accessing treatment. There's evidence that's shown that people of color that uninsured white people had 3 times more access than uninsured persons of color. There can be a lot of different barriers, and that on top of that, when people of color do access treatment, there tends to be higher rates of dissatisfaction, with the main reason being experiencing microaggressions and racism in treatment. And so understanding that as well, and that's not unique to substance use disorder treatment services by any means. This is systemic. There can be a lot of cultural barriers as well. The different myths at play, absolutely. And Lena, yes, being honestly aware of triggers for ourselves and for others. Yes, absolutely. This work requires a really high level of self-awareness and attunement to people who are accessing our services. There's a lot of self-work in this work, absolutely. Thanks so much, everyone. And so a couple of things I'll point out here in case I didn't see it mentioned in the comments. And if you mentioned it and I missed it, I apologize. But a big one is worrying about what if. What if this happens? What if that happens? And that a lot of that really comes from assumptions that people who use substances are somehow going to be in crisis or somehow dangerous. And sometimes this comes up in our field because we do know that the presence of substances can increase danger when it comes to domestic and sexual violence. And so we can really easily jump to the assumption or the conclusion that substances equal danger or substances equal crisis or violence. And so a couple things I'll say here is, one, that when we're talking about a danger assessment, we're talking about there already being the presence of violence and power and control, right? So, and we know that alcohol and other substances do not cause domestic violence or sexual violence, right? That people who cause harm are accountable to their behavior. And so it is, and within the context of a danger assessment, it's that the severity of the harm can be increased, but it doesn't cause the harm to begin with. And so when we're talking about in the context of survivors, we really want to be careful that we're not jumping to conclusions or assuming that just because a survivor uses substances, that there's going to be some added risk of like violence or crisis or anything like that. So that's one piece, is to be aware of the assumptions that we hold and kind of to really interrogate those. What are the facts, right? And what are the kind of connections that our minds naturally draw but might not be based in facts. And that a lot of this, of course, happens because of just gaps in our information, and that as we know better, we do better, and that knowledge is power. Knowledge is power, and that also goes into the importance of, non-coercive information sharing, that we're not seeking to control a survivor's experience or control a survivor's behavior, but we can offer information and we can offer support around just informed decision-making so that people can have the, what they feel like they need to make the best choices possible within their situation and their perspective. And then, of course, just not knowing what would be helpful. And this takes me back to being a program director and how often I would sit with staff and, just talk about, with experience, yes, I have experience to fall back on. Yes, I have some ideas of things I've tried before that might be helpful now. I, have some skills to fall back on, some tools in my toolbox. And at the same time, so much of what I have with experience is an increased comfort with not always knowing, right? Not always knowing what exactly would be helpful in that given situation, and being able to remain present, connected, hopeful, and to really be able to partner with survivors creatively around what feels possible in this moment and what would feel helpful moving forward. And so not knowing what would be helpful can absolutely get in the way. And part of it is, just being aware that that's kind of part of the work. And so not being surprised when we're in that place of unknowing, kind of leaning into it in a way. And then, of course, not being aware of crisis plans and policies or not being able to act on them. So while we don't want to just assume that anyone who uses substances will, experience crisis or be more prone or at higher risk for experiencing a crisis, we still need to have well-developed and realistic crisis plans and policies and support for our staff to be able to really act on those plans and policies. And so at the center, we have a variety of resources around trauma-informed crisis support. And so if that's something that would be helpful to learn more about, we're really happy to kind of point you in the direction of those resources. And so, regardless of whether or not there's substance use in the mix, people at one point or another will naturally experience some kind of crisis. And as people who work with people, part of trauma-informed care, part of just supporting our staff, and supporting the people in our services, of course, is being aware of those crisis plans and policies, and that those plans are actually realistic and helpful. And so, Brianna, I see you have a question here. I'm curious about the difference between substances making DV worse versus causing it. There are behavioral side effects of consuming in excess of alcohol. What role does this play? Yes, absolutely. And so this is where the difference is, for example, and our specialty at the center is not in services for people who cause harm. Our focus is on survivors. But I'm going to use this as an example. If somebody is causing harm within their relationship and they are also using alcohol, for example, sometimes there is this idea that if they just go and get, treatment services around their alcohol use disorder, that then the harm will cease, that the domestic violence will stop. And that's not the case. There's no evidence to bear out that conclusion. And so while the presence of alcohol can increase things like fatality of domestic violence, it doesn't cause the domestic violence. And so it's, just addressing alcohol alone cannot address the behavior of causing harm. Hopefully that example helps kind of illustrate what I was speaking to. And feel free, as we go to enter questions. I might have the opportunity to answer in the moment, and I might need to save it until later on. So don't feel bad if I don't get to it right away, and don't feel bad to ask it again at the end if I missed it during. And that the more that we can understand that we tend to see things from our own point of view, the more that we can really connect with a survivor and with their experience. And understanding that a survivor always makes sense within their own context. We may not be able to totally understand someone's substance use. It can be really easy to slip into judgment when that happens, or to slip into a kind of like, well, they just need to go to treatment, right? Kind of like almost like trying to determine for them what is needed. And that we want to be really, really careful. And so I'm going to offer a different kind of frame here, that when somebody's substance use seems really counter to their goals, to their well-being, to their safety, instead of trying to, instead of slipping into judgment or labeling or trying to kind of take control, instead we want to really deepen our empathy and try to understand them from their point of view. And so the question in our mind that can be much more helpful here is, what is this substance use? So how is the substance use so important in their lives or so helpful in their lives? Or why might they feel like it's so needed in their lives that they continue to use, even though that is in direct challenge to their goals or to, other areas of kind of well-being in their life. And this reminds me of having spoken with survivors in the past, that so many survivors of domestic violence and sexual violence and substance use coercion have shared with me and with others in panels I've moderated before, that their substance use was both harmful and helpful at the same time. That it was harmful in, all the ways that we kind of already know, right? And at the same time, that there were discrete points in their life where using a substance saved their life, because otherwise their experience was that they would have died by suicide without that. So it's something that, we really need to move beyond simple answers and understand that life is complicated and life can be messy in a joyous way as well as in very painful ways, and that we, really want to be aware of what are we bringing into this interaction, what perspective are what are we projecting into the interaction, what is really coming from our own perspective, and then how can we be really open and empathetic to the experiences of others. And so, of course, a really core part of this work is reflective practice. And sometimes we only talk about reflective practice in the context of direct services, of like being an advocate or providing advocacy services, or of being a counselor or providing, treatment services, therapy services. And this is really important for administrators too, for our administrators and our, coalition members on the session, that anytime that we are helping to shape policy and practices, and when I say policy, I mean program policies, but it's true for, greater policy as well, but program policies, anytime that we are playing a role in the interpretation and the application of those program policies and practices, we need to be really aware of what we're bringing to the interaction and including that in reflective practice, and that we access that through reflective practice. So here's just a couple of examples of some of the questions that we could reflect on our own, as well as discuss within our teams, and make it just kind of a routine part of our team meetings to be able to talk about, these different parts of our experiences and how they might be showing up in our services and in our policies. And to do this in a way that, with the same care and tenderness that we have for the people in our services, with the same empathy, right? So with that, being aware of when judgment's coming up and truly making it a safe space for all of us to be able to kind of explore these parts of our experiences and how they might be showing up in our programs and in our practices. And here's another set of questions that can also be helpful. And this is more directly reflecting on how are stigma and discrimination against people who use substances, how are those showing up in our services, in our policies, and what can we do to really enhance safety and equity for all survivors? So sometimes we get stuck in these kind of like false either or false dichotomies, that if we increase safety for survivors who use substances, we're somehow decreasing safety for survivors who don't use substances. That can be a really common question and a really important question to reflect on as a team and think about where is that idea coming from, and how, what are some other potential ways of looking at this. And that so much of what we have to offer within our role as advocates and within our role in advocacy programs. So maybe if you are a substance use professional, but you're in an advocacy setting, for example. So really, a lot of times there's this question of, well, do I need to, be a substance use specialist in order to really support a survivor who uses substances? And while integration and collaboration are fantastic strategies for supporting survivors who use substances, everyday advocacy skills are really many times what a survivor needs in really navigating their experience. And so supporting survivors as an advocate isn't about becoming a substance use counselor, even though, of course, that collaboration, that integration is really important. But when we can approach the relationship with substances as any other relationship that may contain risk and danger, and to really support survivors and offering that non-judgmental, integrated safety planning support, that when we can really remain rooted within our advocacy, that is where the magic is, right? That is where it can be really, really helpful for us as advocates to show up with survivors. But in order to be able to do that, right? So here I am saying these skills you use every day are absolutely what you want to be using when you are offering support to survivors who use substances. So what gets in the way, right? It's stigma. So the key to being able to really use all of our unique strengths and skills as advocates is to really eradicate stigma in our services. And so now I'm going to invite everyone to go ahead and answer this poll. And so this poll question will have a couple different options. And it's, our programs are safer when survivors are either screened out for substance use and must hide or deny use, or are able to talk with staff and safety plan around substance use. And I will rely on Carla for launching that. Thank you so much, Carla. And you'll have just 60 seconds to answer. All right. Are we able to see the results? All right, here we go. Wow. So kind of by a landslide, the second option was selected. So 86% responded are able to talk with staff and safety plan around use. And 1% selected the other option, and then the remaining percent didn't respond. So I'd love to hear from folks. Feel free to put in the chat and share with one another why our programs are safer, why you think our programs are safer when survivors are able to talk with staff and safety plan around substance use. And as y'all put your thoughts in the chat, I'm going to move forward and just offer some data around this. So data can be helpful when really what we're aware of is our own experience, but when we can look at data that has been systematically gathered and we can really look at what are some of the long-term outcomes, because we might only know somebody for really this potentially short window of time in their experience. So what does it look like over time for folks? And this is looking specifically at voluntary services within residential programming and substance use disorder treatment. So here, this is looking over 2 years. And so looking over 2 years, it was found that people in housing programs that didn't require abstinence from substances and didn't require participation in services, like not requiring going to treatment, that those people were more likely to engage in substance use disorder treatment and did not use more substances compared to those that were in housing programs that required abstinence from substance use. And this is something that I have seen reflected in my own experience working in both kinds of programs. That what I saw time and time again is that if a housing program required abstinence from substances and required people to go to treatment if they were found to be using substances, I remember finding, beer cans in the trash. I remember all the time, just all the different ways that kind of the signs that substance use was happening. And what wasn't happening was the conversation about the substance use. And then there's also evidence that has found that housing in and of itself, that stable and safe housing in and of itself can be healing. And so this was looking at actually 12-month data. And it was found that people were more likely to remain stably housed and stop using stimulants, which include drugs like cocaine and methamphetamine, and stop using opioids, which includes drugs like heroin and different kinds of pain medications, that it was more likely for people to just completely stop using these drugs when the program used a person-centered and non-judgmental approach that individualized services to a person's self-identified needs and goals. So it's not about us convincing someone that they have a problem. It's actually about meeting them where they are and hearing from them what they see as their needs are and their goals are and potential solutions, right? Those individualized services for their self-identified needs and goals. And that the programs didn't require enrollment in any kind of substance use disorder service or treatment. But the programs made services available that provide information and resources on minimizing the adverse consequences of substance use, right? So that it wasn't about telling people what we think they should be doing or telling people about, oh, well, this is dangerous and here's why you should stop, right? That it actually was about meeting them where they are, coming alongside and saying, hey, you're the one who, this is only your decision. This can only be your decision. And I'm here to offer some services, some information, some resources on, how to be as safe as possible, right? And then actively engage people and fostered open communication about substance use. And that so often people are really very frightened to talk about substance use with us, or if we're in a setting that's substance use specific, they may still feel a lot of shame around their substance use and fear that we're going to judge them, or even worse, potentially that they are going to get discharged from our program. In talking with different programs around the country, I hear time and time again from providers that when a survivor talks about their substance use, many times one of the first things they ask are, am I getting kicked out, right? And that there's a lot of reasons for that. One is because of the enormous stigma that people who use substances face in really every area of our society and our different services that we offer. Another reason is because there's so much judgment, there's so much emotional abuse, there's so much gaslighting that happens. There's so many ways that societal stigma gets used as part of the pattern of power and control and as parts of the tactics of abuse in domestic violence and in sexual violence, where people, then all the victim blaming that happens, where, people are told by partner or ex-partner or person causing harm, as well as from family and friends, and sometimes even from professionals, are told, well, if you wouldn't have been drunk or if you wouldn't have been high, maybe that wouldn't have happened to you. Or they're told, well, what was your role in that? What do you think would have happened if maybe you weren't so drunk or you weren't so high, right? And so part of the stigma and part of the abuse and the constant blaming and gaslighting and undermining, as well as tactics of control and really isolating people from sources of support, so much of that is intertwined with a survivor's experience of substance use that all of that comes rushing to the surface, right? And then it's, we talked about, right, in the comments, kind of people's triggers potentially. Well, if I've been being abused because if substance use has been part of the pattern of power and control and violence and abuse that I've experienced, then of course, when someone who is in a position of power over me, who is a service provider, starts asking me about my substance use or starts kind of trying to dig into that part of my experience, I'm naturally going to feel some fear because of the abuse I've experienced. I'm naturally going to feel like, is this person going to kick me out? Am I going to be, out there again? Am I going to be judged? Is this going to be used against me? Am I going to be harmed again? Right? And so when our programs have to be the exact opposite. We need to be able to actively engage people and foster open communication in ways that are completely person-centered and non-judgmental. We need to be the radical opposite to the abuse that they've experienced. And so voluntary services and housing are going to really focus on that adequate support services are provided, that engagement in services is not demanded and is not a condition of other services or housing, and that ultimately it's the staff's responsibility to actively engage people, to help them, to help build safety in our programs and in our interactions, so that, and to offer services that are really individualized and survivor-centered, and that are really tailored to meet survivors' self-defined needs. And so I want to hear from y'all, both what are your programs already doing, as well as what are some ideas that you're having as we kind of engage this afternoon or today. How do we build safety for survivors to really be able to talk about their experiences with substance use with us? So how do we set the table for conversations about substance use? What's really needed? And so as I invite everyone to go ahead and answer this question in the chat, and then I'm going to go forward and here I'm going to really talk about what are some of those policies that support safety. So our programs, from an administrative level can have the greatest impact by creating and adjusting policies and practices that counteract stigma and promote safety for all survivors. That if we are at any point saying, well, we're not going to sacrifice the safety of these survivors for these other survivors, that we're already have fallen in a trap, we've already fallen in a pit, and that we need to back ourselves out of that pit and look at and use our creativity to look at all the different potential solutions. Everyone's safety is supported when programs are able to create an environment where survivors can safely talk about substance use. When people are in environments where they need to hide their use, this shuts down opportunities for staff to offer support with safety planning around use. And in turn, that increases risk for all survivors, their children, and staff. So now what we'll do is that we'll go into several examples of policies and practices that are aligned with really cultivating programs of safety that support community health and safety within our programs. And so the way that this is set up is that I have a policy and then I offer many practices as examples of that approach and that policy. So first, the policy that services are fully accessible regardless of a person's substance use. And so this is true across the board of advocacy programs as well as substance use disorder treatment programs. And something that I point out often, pretty much whenever someone will give me a place to point it out, is that stigma around substance use is so pervasive that it even exists in the substance use disorder treatment field. Because what other health field would ever discharge somebody because of a symptom of their health condition, right? And so we would never dream of, discharging somebody from their primary care if their blood pressure was high, right? Like that doesn't make any sense. And so what really explains that is stigma. So here, really eradicating that stigma. So some practices include that survivors are neither expected nor required to disclose their substance use to staff, because that is all about power dynamics, and that is not our role, and that is not healing. So instead, staff are focusing on setting the stage for safe conversations about substance use, and to be really clear that we're not setting people up for some kind of gotcha, that we're not telling them like, oh, it's safe to talk about substances, but now you have to do X, Y, Z. No. That really, so the kind of like pre-work is really ensuring that our programs are a safe place for survivors to be able to talk about their substance use and to be really clear on the front end. What does confidentiality look like? What does mandated reporting look like? What would all of that look like before we start asking questions that may need to end up getting shared with other bodies or other systems, right? Some other things to keep in mind here are building a supportive relational environment, normalizing that experimenting with or using substances is a common reaction to experiencing violence and coercion. Being able to model really matter-of-fact and empathetic and non-judgmental approaches to substance use. That, really moving into a matter-of-fact manner when it comes to discussing substance use. Avoiding the use of any kind of confrontational approach, and just letting people know that staff are available to listen and support if and when a survivor would like to talk about their experience with substances. So a lot of times this can just look like, a lot of people have shared with us, or a lot of people who have, that we've met with in the past have shared with us that they have at one point or another used substances to just deal with what they're going through. This is a pretty common reaction. And so if this is something that it would be helpful to talk about, or that, we could offer some support around, our staff here are experienced and have different resources available, and we're also happy to just listen. So if that's something that would be helpful to, connect with any one of us around, know that we're here for you. All right, that can be just really simple. And then, obviously offering some different services and pieces in our programming that speak directly to substance use, but not overwhelming people with it, and really using what I call an invitational approach, kind of offering, inviting, and then really allowing for space for people to make their own decisions. And then along the same line, programs have clear and concise policies regarding substance use, including guidelines about the possession and use of substances on site. And so these policies need to be communicated in a way that is accessible, both verbally and in writing, and that are understandable. The policies that do exist need to be clearly connected to creating an environment of safety. The policies focus on safety, not on changing or controlling a survivor's choice to use substances. And survivors are then included in cultivating that environment of safety. So safety is not something that only staff are providing in the program or that only staff are responsible in the program, but that we all have a role in creating a safe environment. And something I'll say about, guidelines around whether substances can be had on site or used on site, or whether somebody can come back on site after they have used substances and are under the influence. I will say that every program has to make these decisions for themselves. And what I've heard, and many of us at the center have heard from programs that have decided to say, to base their guideline on, okay, you cannot have substances on site, you cannot use substances on site, but if you have and use substances off-site, you can return, even if you are under the influence of that substance, and that this can be a safe space for you to be in. And what I've heard from those programs is that has actually increased safety in their programs, because having a guideline that was clear, that was clearly related to safety and not focused on kind of control, and having a guideline that felt, frankly, realistic, that actually was much more engaging for survivors, and that survivors then were, in their program were able to share, like, okay, it's clear now kind of what the guideline is, and it's not kind of this unattainable, unrealistic rule that was just, I'm just trying to survive here, and now there's this rule that is completely unrealistic for me, right? And so if folks on the call today have had that experience of kind of changing that kind of policy, and you have experiences you want to share of the effect that had in your program and how it relates to safety, please feel free to enter and share your experience in the chat as well. And it doesn't mean that it's always simple. It doesn't mean that it's all roses, right? All the work we do is inherently complex. That's why we're always learning. So programs do not impose artificial consequences for substance use. And so substance use in and of itself isn't cause to restrict services or to exit somebody from a program. That any programmatic consequences for substance use that are experienced as punitive or contribute to any harmful dynamics of power and control. So any kind of response to substance use that is meant to try to set up a consequence for substance use in and of itself is just going to entrench us in really harmful dynamics of power and control within our relationships and potentially be re-victimizing. So we really want to be aware of any times that dynamic may be coming up in our programs and may be supported within our policies, and we need to eradicate it. And when a survivor uses substances and experiences a natural negative consequence associated with use, so not an artificial one that's like a punishment that we're kind of laying on someone, but a natural consequence, like maybe they were denied employment due to testing positive on a drug test as part of the hiring process. but something that's just a natural negative consequence of the use. Advocacy staff provide an empathetic and non-judgmental support that to be in alignment with a survivor, to be on their side, and to really offer that support as they experience these harms, and to offer a space to both tend to their, emotional well-being, to be able to provide that emotional support, and also to help strategize around their substance use if that's something that they welcome from us. And that, people need to be able to experience us as a support, as an ally, as an advocate in order to be able to kind of trust us with these really painful experiences in their lives. And so people aren't going to be able to kind of invite us in to look at, how they could potentially make some different decisions or what would help if they, want to change their substance use if they don't experience us as someone that they can trust, right? This is what it kind of comes down to. And then here, having clear protocols for trauma-informed crisis prevention and response, and that staff have the support they need to implement those established protocols in times when a survivor needs staff assistance in maintaining safety, and that this is true whether or not substance use is involved. And so some ideas here that can be specific to substance use, that it can be helpful to create stable access to food and water. And so many of our programs already do that, right? We already ask folks at intake, what are some comfort foods? Or we already have, kind of on-site or potentially delivered, kind of food resources if we are working in a community setting or maybe using like hotel vouchers. Also, keeping in mind that certain medications or medical conditions can require eating outside of established meal times. And so regardless of substance use, having the ability to really have that stable access to food is essential for our overall just well-being and sense of stability. That's really a part of trauma-informed services anyway, and can be especially helpful when it comes to substance use as well. Sometimes lack of food access can really drive chaotic substance use. And also there are some different kind of side effects that may come with use, that if somebody has stable access to food, it can kind of decrease some of those side effects. So for example, sometimes there is a concern around the experience of paranoia and the use of stimulants. And actually being able to eat before use and during use and after use can help kind of reduce that sense of unease that can contribute to that, what's kind of called paranoia. Also, this is where we really want to be sure to be cultivating partnership. So if there is a specific behavior that's creating a safety concern within the program, staff can offer support around that specific behavior rather than focusing on whether or not substance use has occurred. So I remember talking with a program and they said, well, what would you do if there was this kind of aggressive behavior, right? And it's like, well, like what would you do about the aggressive behavior whether or not substance use was in the mix, right? We would use our trauma-informed crisis response skills. We would try to connect with the person, understand what it is that is making them feel unsafe in that moment. How can we help build safety, right? And all those different kind of crisis skills that we learn anyway. And so we focus on whatever the behavior at hand that is kind of causing that danger rather than kind of focusing on the substance use itself. And then we partner with each survivor in creative and in flexible solution finding to help them address that specific behavior. So if a survivor seems to be experiencing some, kind of emotional dysregulation, then we can engage them in a soothing environment and offer self-soothing and co-regulation strategies. just like we would with really any other situation. And chances are you've already probably used a lot of these skills with somebody who's experiencing the effect of a substance and just hasn't told you that they're experiencing the effect of a substance and you haven't noticed, right? Because substance use is pretty common when we've experienced trauma and violence. And then, of course, once the immediate safety need has been resolved, then we do want to have some follow-up conversations. We want to get their input on what happened. We want to respond with empathy. And then we want to offer that collaborative solution making that can address whatever needs might be coming up, as well as the program's safety needs, kind of the program community safety needs. And of course, if at any point a child welfare report is required because of mandated reporting, then we want to be sure to use trauma-informed approaches. So use as much transparency as possible, give the person the choice to be present and involved in making the report, support them to understand what comes next and what is being requested or required of them, and then advocate with child welfare systems. Something that we know to be true is that when survivors are experiencing substance use coercion, so that the substance use is part of the pattern of abuse and violence and power and control, that many times threats to involve child welfare, as well as actually involving child welfare and child custody, can become a part of the way that someone who's trying to cause harm against a partner or ex-partner can try to further threaten and entrap and isolate and exert power and control over a survivor. And so what we need to do, of course, is show up as advocates, be aware of this kind of abuse that is so incredibly present. Whenever there is substance use and parenting involved, this kind of abuse and substance use coercion is incredibly common. I've spoken with both advocates and treatment providers who've shared with me that almost every time that there's substance use and children involved, there's also threats from an abusive partner or ex-partner around involving child custody or child welfare proceedings, and that we need to really advocate for them within these systems in all the different ways, including being able to clarify what the requirements even are, because sometimes those requirements are not very clear or understandable. I remember working with a survivor who, kept getting phone call after phone call of, call the worker back, and every time that we would call together, the voicemail box was full. So it just seemed like there was no way for her to document that she was trying to call this person back, right? And then, the risk of how survivors get held accountable to mandates that are unrealistic or even sometimes impossible. And so there's a lot of kind of trauma-informed advocacy that's needed there. And that as advocates, it's really important for us to recognize that punitive approaches are never the answer, that we're here to offer support and resources. And so something that can be helpful in shifting our approach is thinking about not that someone is doing something wrong, but thinking about that someone is experiencing a need. So it's not that someone's breaking a rule, it's that someone's experiencing a need, and how do we show up in that way, right? Something that might be helpful here is a recorded webinar we have that's called Trauma-Informed Responses to Emotional Distress and Crisis. And so another policy, services are provided on a voluntary basis. And this is something that we've talked about a little bit already. And so here we do want to be aware of a lot of different kinds of services and resources, and have services and resources that speak to a range of experiences. That survivors are the ones who decide what might be helpful, what might be possible, when it might be helpful, the timing and the pace. That's incredibly important. What might be helpful, now might be really different, 2 weeks from now or even a day from now. And that it's a range of resources that speak to the range of where people are at with their substance use. That, if all we have is referrals to treatment, then we don't really have a resource to offer over 80% of people who use substances. Because over 80% of people who use substances are not ready or able to stop using in the given moment. And so what are the wide range of resources available, including harm reduction resources, including integrated safety planning, including recovery community resources, right, that we can offer folks no matter where they're at with their relationship to substances. And so if folks are in our programs, they're letting us know, like, I don't have a problem, or I'm not really ready for that, or that's not really what I need right now. Sometimes that can be a point of frustration. Like, what do I do with someone who doesn't think they have a problem, right? That can be a really common question. And so if you've had that question, never fear. You're not alone. And something to think about, or maybe to add to that frame or that question, is how the vast majority of people who use substances don't feel like they're ready to stop, aren't ready or able or willing to stop in that exact moment, and that there's still a lot that we can do to support them, and that when we show up with that individualized support and access to information on how to stay as safe as possible within their choices, that people find their way towards healing, as we saw in the data that I shared earlier. And that said, that folks who are interested in those different resources and are looking for them, that we have established linkages, relationships, collaborations, or have integrated services on hand that can be safe for survivors to access, that are actually accessible for survivors to access, because the vast majority of survivors who have tried to access some kind of treatment service have also experienced treatment and recovery sabotage from a partner or ex-partner. And so we have a big role to play in helping people to safely access those services or any services that they're interested in around their substance use. And so here, something that we want to do is have a wide range of services that are responsive to the diverse experiences of substance use and recovery. And this reminds me of this shelter director who I'd spoken with. Well, they do more than residential services, so they have a whole range of services, community and residential. But one of the things that she shared with me, and I've learned a lot from her, one of the things that she shared with me in their services was that they had set up 2 different kinds of support groups. One was for people who were actively in recovery and who were interested in recovery and actively wanted to make changes around their substance use. And then they set up a support group for people in their residential program who were continuing to use and did not have a goal around kind of abstinence or stopping their use. And what had actually happened was that people weren't coming to the group that was set up for survivors who were continuing to use because very likely because they felt like it was a setup. They felt like, oh, sure, I'm going to show up at this group and kind of out myself like someone that I'm using, and then now I'm going to be scrutinized, and, people are going to look at me differently, and people are maybe even going to kick me out, right? And so what ended up happening was that the people who were more active, in a more active stage of change, more active in their recovery, felt so kind of supported and grounded and connected with the program that they actually started reaching out to the residents who were actively using. And then through that peer-based connection and that peer-based support, the people who are actively using actually started coming to the support group for the people who are in active recovery. And so they ended up not even really needing 2 different groups after all. And that because it really it built that trust that they could come and get support and not be judged and not be, kicked out or anything like that. And that peer-based support the shelter director shared with me was really the kind of catalyst there. And they've actually gone on to launch much more peer-based support programming since then. And so, kind of in that same vein, organizations providing emergency shelter services provide residents with individual lockboxes where they can privately store belongings, including medication. And that this is an essential part of what's helpful in not screening people out for substance use, but screening people into our services based on DV-related criteria. And so here, we really should never be screening anyone out. We should only be screening in to our services. And so something that a lot of programs have found helpful in addressing the concerns of staff and of survivors as well is, that having access to that private locked space to store any of their medications or valuables or anything like that. And also that we are really respecting people's privacy, that we are avoiding the practice of searching people's rooms or possessions, because that kind of screening sets up a dynamic of staff being rule enforcers rather than advocates and supports. And that pulls us right into that power dynamic where then people feel like they need to hide something from us. And that just increases danger for everyone. And something that can be helpful here as well is having sharps containers that are posted in bathrooms and other areas where people may need to self-administer injections. And that a lot of programs already have sharps containers for people who self-administer injection medications, particularly in communities that, may be impacted by different kinds of health conditions that may require more self-administered injections. But something that a lot of times people have asked is like, well, we're finding a syringe in the TV room. Am I just going to open the floodgates when I start, not screening people out? And so this is where we need to think about, no, it's not the floodgates that are going to open. This reality is already a part of your program. And so by facing the reality and thinking about what are some safety pieces to put in place, it's going to make it safer for everyone. And then, of course, that the program does not ask survivors to submit to any kind of drug screening or use of breathalyzers for any point, for any reason, at any point. Does not use any methods that would detect the presence of drugs or drug use. So mandatory drug testing is just absolutely not aligned with any kind of trauma-informed approach, and it's not considered an acceptable practice in DV programs. And in fact, it can be really harmful to survivors whether or not they use substances. And it's not aligned with any kind of funding requirements from any funders as well. And drug testers really don't tell us what many times we think they tell us. So according to the American Society for Addiction Medicine, drug testing should not be used as a tool of punishment or taking away privileges. And they're talking about substance use disorder treatment programs. And when I ran treatment programming, we didn't use any mandatory drug testing either. And I'm happy to talk with treatment professionals who are on the call more. I'm happy to follow up more after this call about what we did instead. So mandatory drug testing is physically, emotionally, and socially coercive, as well as humiliating. Whether or not we like it, it sends the message that a person is only deserving of safety if they're free from a substance, and that we don't think that a person would tell us the truth. So it feeds into really harmful dynamics in our programming. And so it can be really re-victimizing for survivors. So if your program requires any kind of drug testing or breathalyzer or anything like that, here are some things that you can do as a team to pause and reflect. When did your program start drug testing? Has it always been this way, right? Where did the idea of drug testing even come from? And what information informed this idea? Where are the assumptions? Where are the facts? Kind of how did we even get here? And then what do you think that it is doing in your program? Are you using it to screen people out, right? Are you doing it because you think it supports recovery efforts? Are you doing it because you think it'll protect other residents? And here, really having those very, very kind of deeply reflective conversations where we are really interrogating these assumptions, because I'll give you the Cliff Notes version. People can use substances and it still won't come up on a drug test. People can use substances and still be engaging actively in their recovery. Or people could, drugs could not be picked up on a drug test and they're still not very engaged in recovery efforts. And we're not here to dictate whether or not someone engages in recovery efforts. And substance use does not equal danger or crisis, right? This is why we have our crisis protocols and our support for folks. And then, of course, our policies and our programming to support parenting and children's well-being. And we could talk a whole day about this and probably should in the future. So if this is a topic that you feel like it's really important and you're really interested in, please feel free to put that on the evaluation. So within our program policies, we want to support survivors to responsibly parent while also recognizing that many people use substances and still responsibly parent. That just because a survivor uses substances does not mean that they're unable to safely and responsibly parent. If and when there's any reason that someone's parenting is being compromised or there's been an interference with a person's ability to parent for whatever reason, we do, as a program, want to address whatever the immediate safety concern is. And then once the crisis is passed, then we can connect with the person to talk about what happened and support them in making a plan to prevent a similar situation in the future. And that we want to align with parents, that we have a shared goal here around supporting parent-child attachment and safe parenting. We know parents want to do the best for their children, and we know that sometimes for whatever reason that can be hard, and that we're here as a support. And then I already mentioned earlier that if there's any kind of child welfare involvement because of substance use coercion, or if we needed to, or someone else needed to make a mandated report, and it's so important for us to advocate and to partner with parents. And if we are required to submit any kind of report to child welfare, then we need to use the utmost transparency with that and do that in a way that's really thoughtful and transparent, and that we're sharing, well in advance what it is that we can share, and asking people their thoughts on that, if there's anything in there that they want us to be able to reflect, and if it's something that we wouldn't be able to accurately reflect yet, asking them how can we support them so that we can accurately reflect that in whatever we need to share with those systems. And also just preparing people for different kinds of court appearances and meeting with different systems, because those can be re-traumatizing. Absolutely. And in my less than a minute, I'll say, here are some additional things to keep in mind that can be helpful in supporting safety in the program environment. Overdose prevention policy and protocol, including training and access to naloxone, and there's a lot that communities have been doing around this for the past couple of years, and there's a lot that we can offer and connect you with folks who are already doing it as well, so you can hear about their experience as well as so much more. And please go to the guide for more information, of course. So stay tuned. We will have an online resource hub that's dedicated to supporting survivors who use substances within residential settings. And if you are a survivor, if you are an advocate, if you are a shelter director, a coalition, or a substance use provider working in a shelter, please, and you want to highlight the great work that your program is doing and offer different tips and pointers for folks and just offer your experience, please feel free to get in touch with me. I'd love to hear from you and feature your program on this resource hub. I hope you'll join us in March and May. I'm so sorry I ran out of time to address questions. So here is my contact information. Please, please, please feel free to email me. The phone is not as helpful right now since we're all remote all the time right now. But please feel free to connect with me through email, get social with us and social media. And I do my best to respond to emails within a day or two. So please feel free to reach out to me. And I want to say thank you so much to everything that you're doing to support survivors, those who use substances and those who don't, and their children, everything you're doing to support staff. And I want to say thank you to Carla for making the webinar run smoothly, of course. So within the next week, we'll send you a follow-up email with a link to the recording of today's webinar, in addition to the slides and any handouts. And then you'll also receive a certificate of attendance for your time today. And then at the end of the webinar, you'll be taken to a brief evaluation. Please, please, please take a moment and share your thoughts, share your reactions. Let us know what was meaningful, what was helpful, and let us know how we can improve. We always want to find ways to make things more relevant and more useful, as well as any other topics, either about substance use or about other things in general that would be helpful to hear from us on. And again, I just want to say thank you, and I hope you all stay safe, stay healthy, and I hope you have a wonderful rest of your day.